Today I would like to make a video about how to restore a tooth. It's quite important that when a restoration is needed, the tooth is restored perfectly. The material that you use for the restoration should be an equivalent of the enamel, and the restoration has to fit perfectly. In order to do that, I use the Zeiss microscope. It's a beautiful microscope. It has a zoom possibilities. It has extra magnification, which is beautiful to allow me to look at the tiniest details. I will show you on these pictures that I made during a treatment that I will show you on the pictures that I made during the treatment, but how I'm doing that. So here is an overall picture of the teeth of the patient. Today we are going to restore these 3 teeth. In the mouth they look like this. They are amalgam restorations. They don't function well anymore. They are worn out and they don't support the bite of the patient anymore. Thereby it's hard to clean them and it's possible that you get new cavities here. This is how it looks like on the X-ray. Here's a cavity under the restoration. Here's a cavity under the restoration. And this seems all right. I show you, here's a cavity, and this might be one. When I take out the amalgam, it looks like this. This blue area is called rubber dam. This is used to prevent the amalgam to touch the mucosa, the tissue of the mouth, and thereby it gives a better overview of what I'm doing. And for the patient it's very comfortable because the patient doesn't get the drilling water in her mouth, and it's not necessary to swallow over and over. Here you see small remnants of the amalgam, and here too, and that prevents coming in the mouth. After cleaning and taking out the amalgam, I test with a red liquid if there's still decay in the tooth. When it's a bit pink or reddish, there's still some demineralized dentin, what you can see on this picture. Then after cleaning, I cover the side where the pulp is, where the vital part of the tooth with the nerves and the blood vessels are protected with this tiny layer of composite. After doing the preparations and making the margins smooth, we take an example of a color and see which color would match best for the new restoration. So this was the remnants of the decay, the selection of the color, and then after 3 weeks we have the restoration ready. The white area that you see here is a temporary cementum, what protects the dentin. So the temporary restorations are out now and we have to clean this area. Again we use the rubber dam to protect against moist and prevent moist from coming in the patient's mouth. Then we fit the restorations. And they have to fit perfectly. These margins should be very smooth, no tiny gap, no overhang, which means that the restoration is too big or too small. So we start with placing this restoration. On this side, you see the protection layer that we made while we're doing the preparation, and the teeth is still in good shape. This is a nice picture of the looks, how healthy the gums are. And this lady is using the Basal Basics remineralization package. She read my booklet 2 years ago, and then she wondered, how can I fix my teeth? And then finally she came to me, and now we are helping her with fixing the teeth. She's using the minerals already for some time, and you see no plaque, very healthy gum. So here we fit the restoration. And it fits perfectly. There are no margins that do not fit. Check again. And then, before we're going to place this restoration, the tooth has to be squeaky clean. We use sandblasting material to make it clean and a little bit rough. When it's rough on the inside, the bonding of the restoration to the tooth is much better. Here's the super clean tooth. Then we protect the neighbor tooth with a Teflon layer. It's a tiny piece of material that prevents materials that we use here get in touch with this one. Then comes the etching procedure. This blue liquid is an acid, a very strong acid, that demineralizes the enamel a little bit so that it becomes even more rough. Then the enamel can hold the composite that we are using to glue the restoration much better. So all the enamel margins are etched. Then we rinse everything out. That takes about 1 minute to take all the etching material away. You see here some drops of water, but the enamel becomes a little whitish. Then we use dentin primer. Dentin primer is to make the attachment to the dentin of the restoration much better. It has been discovered in 2006, and because of this dentin bonding procedure, they discovered that the dentin can hold the restoration as well. So we have 2 spots where the restoration holds very good, and that's on the enamel and on the dentin. Then it's a liquid that has to evaporate. And then when it's evaporated, the dentin looks a bit shiny. After that, we put the bonding on the restoration and on the tooth. The bonding is a tiny, tiny liquid that gives the final composite a better attachment to the restoration and the tooth. And for the placement of the restoration, we use this composite. It's a wonderful composite. It has special qualities. When you hold it without doing anything, it's quite stiff. But when you start putting pressure on it, it becomes liquid. And you see it here. This is the composite. It's a stiff, dense material. You can put it in the cavity so that everything is covered, and then the restoration comes into place. And with a light pressure, you see the composite flowing under the restoration. Here's the composite, here's the composite, here's the composite. So by putting pressure on the composite, it becomes flowable, and it leaves a little bit of material under the restoration to the tooth. And it has to be done in small steps so that you can monitor the way the restoration is getting on the right place. And when it's on the right place, you see no composite material anymore. And then the final step is that you push a little bit, then a little bubble comes out here and here, and you know it fits perfectly. It's a tiny, tiny bubble that comes out. The tiny, tiny bubble, which is a very important step before you harden the composite. And when it's hardened, you can take away this little bubble. And when it's done, you see with this fluorescent photo that there still has to be some polishing done, but that here is a tiny, tiny margin which is filled with composite. And when that one is done, we can go to the next one. Covering with the Teflon shield, then the etching procedure, the whitening of the enamel, the dentin primer, and then the restoration goes on. And then finally, you have 3 perfect fitting restoration of a porcelain material that has the same qualities as the tooth itself. This is a restoration that can last a lifetime. So this is how I do my restorations and the dentists that work here in my practice. We want teeth to last a lifetime. And that's also why we recommend the Basal Basics remineralization package. It's the minerals, the fundamentals, it's the vitamin C and the oils. All 3 are very important, and especially some attention to the fundamentals, because you consume them during the day. Of the vitamin C, you can store a little bit, same for the oils, but the minerals are used on a daily basis. There is no reserves in the body other than in the teeth or in the bone. And the body doesn't take it out of the bone when it doesn't have enough vitamin D3. So the vitamin D3 is also in here. And according what the EU says regarding vitamin D3, it says vitamin D contributes to the maintenance of normal teeth. And I like it that they support that. And I see that here on a daily basis. So on one side, when a tooth needs to be restored, do it as good as possible. And then the patient's obligation is for his own teeth to take care of them. Make sure as a patient that you have enough minerals, and it's in the fundamentals. And when you use them 3 in the morning and 3 before you go to sleep. And make sure, and I underline that, make sure you accompany that with some fatty food, like young cheese. Because this needs support to digest it, and the vitamins need fat to be absorbed. So I wish you healthy teeth for all of your life, a dentist who restores the teeth that they can last a lifetime, and be disciplined in using your remineralization package. Thank you for your attention. If you like to see more videos, then please push the subscribe button. Thank you.